Joanne Laporta. I'm an owner and audiologist at Accent on Hearing in Castle Rock, Colorado. We wanted to do a video today and we decided to choose the topic of candling. We get so many patients in our office asking about candling. Does it work? Is it safe? So we thought we would have our own little experiment. As an audiologist, we have found and heard that candling can cause a fungus in your ear canal. It can cause infection. It can leave hot wax in your ear canal as well as some soot. It can also perforate your eardrum. All these things are pretty negative. So we decided we would do an experiment to see if it really does work for removing wax from the ear canal, even though the carton says that it's really for relaxation, not for removing wax from the ears. So we're doing this experiment. Thanks for watching us. Appreciate it.
Hello, my name is Dr. Martinez. I'm an audiologist here at Accent on Hearing. Today we're going to be doing an experiment with ear candles. We're going to be using beeswax candles that are unscented with a no drip filter. The reason we're doing this experiment is to see if ear candles actually do remove earwax from somebody's ears. We do have an individual here with impaction in her ears. We're going to show you pre-candling what that impaction looks like with video otoscopy. Then we're going to do the experiment with the candles. We're also going to have an identical candle set aside to show what's kind of left over from ear candling. We're going to cut both of them open to kind of compare and contrast. The other thing we're going to do is show you post-candling what her ear looks like and see if the impaction was truly removed. Don't worry, if the impaction's not removed, we're still going to do some professional earwax removal and going to show you the difference between ear candling and what professional earwax removal actually looks like. Thanks for joining us.
Here we have Dr. Martinez looking into our patient's ear, capturing a picture, which I'll show you over here. There we have it. There's the inside of her ear. Lots of wax. All right, so now we have finished the candling and Dr. Martinez is going to take a look into our patient's ear to see the effect of the candling. Still a lot of wax in that ear canal.
So we're all done with the experiment, and this is the in the cup ear candle, and this is the ear candle that we had in our patient's ears. So just a few things that we did here while we were doing the experiment. It took total about 15 minutes or so to get the candle down to the marking that we had it. But our patient did state that she's heard a little bit of white noise, sounded kind of like an ocean. So she can see where it would be a little relaxing as long as the setting is, dim lights, kind of like a massage studio would be. So she did find it, where some patients would think it would be relaxing, but we are going to see if it did remove any earwax. Another couple things is that we did find it, make sure that you are aware that the cover that you're using doesn't burn, because we did find that ours actually did kind of burn a little bit. And then in the cup here, it's a little bit of soot left in this one, but we are going to cut the candles open to see what is inside of each of them. So we're just going to cut these open. So let's start off with the one that is in her ear. Don't think I can cut through the no drip filter, but I did cut through a good portion of it. So there we go. That's what's inside of that one. it does kind of give a little bit of a wax, but to me it doesn't really look like cerumen. It almost looks like a powder almost. But this is the one that was inner ear, so I would assume that somebody could think that this could be earwax. Some parts of it do look a little like cerumen, but interesting. So let's cut open the one in the cup. So this one was not in anybody's ear. This one was just on the cup. So. Same thing, just this residue really. It just looks more like a powder. Doesn't really look like earwax to me. So, but I can see somebody who wouldn't really know what earwax would look like, or would be expecting to have something in there. They could kind of just assume that this is maybe earwax, but might just be the stuff from inside of the candle, to be honest with you. So definitely not earwax that I can see in here.
Okay, now to wrap everything up, we had a patient that had excessive amounts of wax in their ear. We used a candle to attempt to get that wax out of the ear, but what we did find was that there was really no significant difference in the candle that was in the patient's ear versus the one that was in the cup. And when we looked in the patient's ear following the candling, there was still excessive amounts of wax in there, which we did remove using irrigation without any incidents. We did find that it was a little scary at times doing the candling, so we would recommend always having somebody with you when you are using this, because it did burn through a plate, and it did get us a little nervous. If you're going to use the candling, use it strictly for relaxation purposes, because it doesn't do anything to get the wax out of the ear. Thanks for listening. Thanks for watching this entire video. I hope you learned something. I know we did. And look for us again. Thanks.